Hello, everybody. I'm Brad Parkinson, and you're listening to Planet Health, or the Planet Health Project. I'm here today with Shannon Burford. We're talking about pathology testing, functional pathology testing, and case taking, what the differences are, and what are the benefits, the pros, the cons. And we'll have a few tips at the end of the session, and for you guys going out to see a naturopath or any other practitioner, what's the best way you can prepare for that. So, Shannon, pathology testing and functional pathology testing and our favourite case taking. What are your thoughts, and what are the differences? How do you define the differences between particularly pathology testing, which is standard conventional pathology testing, versus functional pathology testing?
Yes, so a patient will walk in and basically you've got a problem and you want it solved. So with a lot of information or a little bit of information, you can attempt to solve that problem. So basically the functional pathology testing is giving you a great deal of the function of your body and the workings of the body. It's not necessarily showing disease, but it's just giving you the workings. Regular pathology, that's giving you a lot of the disease state markers, like for example a liver function test. It's showing you the enzymes are making their way into the blood when the liver is breaking down. And you mentioned case taking too. That's the verbal question and answers and gathering data. So in a long time, as you know, Brad, we're spending a lot of time with patients because we're listening carefully to the little clues of what the patient is talking about. Mm-hmm. So I guess case taking is the most cost effective because there's no cost outlay for testing, and listening, you can hear some really key points. Well, this started at a particular time. It was ever since I moved into that house. And regular pathology testing is helpful, but your thyroid might come back okay, but we know that it's not functioning well. Mm-hmm. And functioning testing is very scientific, the workings of the body.
Mm-hmm. That's a good summary, actually, isn't it? I guess with the pathology tests that we get from the GP, which we use, and we can extrapolate a lot of information from that, as we've previously discussed, but they're very much looking for a specific type of pathology. And if certain levels aren't raised, or they're not meeting certain criteria, and they're not out of range, then the GP might not pick up things that what can be picked up basically with functional testing. Where as naturopathic practitioners, we're also looking at the progression of disease before the actual pathology occurs. Like you mentioned, thyroid, where a lot of GPs will look at TSH, and then they may go a bit further, look at some antibodies or free T4 and free T3. If they suspect anything. But quite often they test for TSH, they won't pick anything up, whereas we like to do the full panel, rule out any sort of autoimmune pathology, and look at something like reverse T3, which can tell us where the T3 is not being, or the T4 is not converting to T3, it's converting to reverse T3, which is about 1/100th of the potency, and therefore the thyroid, we consider that an underactive thyroid as such, or contributing factors like selenium deficiency or insufficiency might be contributing to that, and usually stress is behind all of it. So we get to see progression of disease a little bit better. That's kind of what we're looking for, in addition to any pathologies that might present, and the functional pathology testing allows us to do that somewhat, and it gives us a bit more details. Plus something like your microbiome as well, we're kind of investigating that on a greater scale when we're looking at stool testing. And we tend to go into greater details with functional pathology as opposed to the standard pathology tests done by your GP. Case taking, yeah, look, I mean, it's it's what makes or break you as a practitioner, I think, and I get a lot from my case taking. I take really long cases, and I know that's not a lot of practitioners don't necessarily do that, but I find quite a lot of value in that. It allows the patient to also express a few things, and I mean, how many times you're wrapping up a consult and the patient is just hits you with the bomb at the end, some critical information. You go, wow, okay, I really need to know that. Really need to add that to your case, yeah, we'll have to go into depth with those details next consult. Okay, well, for our next topic, I think we'll talk about, which I sort of covered a little bit, I guess, but we'll talk more about the pros and cons of so what are your thoughts on what are the pros and cons of functional testing, and the standard pathology testing, and case taking?
I think if really money is not an issue, money is often a factor. If someone has stress or they're struggling with their health, they might not have the funds to spend. But if money is not a issue, then functional medicine is awesome, because you can spend hundreds, if not thousands of dollars and gather all of this information about your hormones and your sleep and your stool and your hair and everything. And then you can see really clearly what's going on. So that's what is that? That's a con, I guess. And a pro of it is obviously very great detail of information. Yep. Regular pathology, it's a little bit limited. It is a pro is often you can get it from your GP and it's covered under Medicare as bulk billed. Although a lot of them are getting restricted. Like a decade ago, you would often get homocysteine, but now it's not really checked. Vitamin D was scrapped 2 or 3 years ago. That's not a standard anymore. Mm-hmm. It's getting limited. And like you said, with the thyroid, you're doctors only really going to do the T3 or the T4 if you already have on thyroxine or thyroid disease. And the case taking is a bit of an art, so it's up to the practitioner. But it's really time and the rapport and careful listening. But you can gather real solid data from that. Just the thyroid, of talking about temperatures and thermals and hair loss or in eyebrows or bowel motions and things like that. So most cost effective. You can definitely still miss some keys that functional pathology testing will pick up. Mm-hmm. So probably a combination is best. Case taking and functional pathology testing together is brilliant, and that's the best if you can.
Yes, look, I have to agree with you. I mean, I generally get a lot of standard pathology test results come in with my patients when they first see me. They bring their tests in that they've already had, and sometimes there's a nice history of tests, and we can gather some information there, and that can be great. And like you said, it's the most cost-effective way of testing, because they've generally got it already, and you don't have to. They may have got it free through their practitioners already, and we don't have to order more testing. Yes, and we can gather some really good information. But again, you have to do solid case taking, and sometimes I guess the big con with pathology testing, whether it's pathology or functional pathology testing, is sometimes patients will see that as set in stone, especially when you talk about food sensitivity testing and whatnot. Especially if they stop seeing a practitioner, they may alter their diet and be on a very restricted diet for a long period, or they may be referring back to old test results that may be completely different. They may stay on high-dose vitamin D is another thing you commonly see. They self-prescribe themselves vitamin D because they've had it in the past before and felt amazing, and then they've just stayed on this ridiculous dose, and then they're at risk of increased calcium intake, and then not having enough vitamin K and competing with vitamin A and so forth. So there's some problems that can occur with the testing if it's not assessed properly, and if there's not proper case taking going alongside it. So okay, well, for our next topic, let's talk about what your favourite tests are. What tests you commonly use in clinic, and what sort of tests you may impress you as such when you get the results back.
Of course, that's a tough one, Brad, because they're all my favourite.
Yeah.
But I do a heap of hair mineral analysis. I have a special interest in toxicity and heavy metal toxicity and changes in the terrain of the minerals. So that's one I love, and I'm always excited to see something that I've suspected and we've talked about, and we get the results back and, hey, look at that. You can clearly see it. So the evidence is awesome. Same with functional testing. Then probably stool testing is another one, but there's so many great tests. How about you, Brad?
Yeah, well, look, I think the stool testing, and now we've got access to GI map over here, which is complete microbiome mapping, which is a really good test, giving us some really good information there. But there's usually variations between the different stool testings, and there's pros and cons, or some will include 3-day parasitology was very important. For many years, that was the best way to go. But now we've got DNA or PCR testing, which picks things up a minute amount there at a DNA level, which is incredible. So getting these test results back usually give us a lot of information, and this gives us the status of the microbiome, in how healthy the gut is. But on hair analysis, one I haven't used a lot, and I know that you do use quite a bit. It's a bit of controversy out there on hair analysis. However, from what I've seen, it's you've got to, and like a lot of these functional testing, you've got to use the right laboratory. I guess a lab like Interclinical Labs, I think, is very good with their hair analysis, and I think there's a few others. I'm not too sure what you use. But then it's, again, up to the practitioner to really take that information in and assess it properly. And this is what happens. I'll bring up another point, is what happens sometimes when patients get their hands on tests. And it's why it's probably very important to not give them copies of the test until they understand more about them and you can explain them through, because quite often I see that they misinterpret tests and they go down a whole another pathway and incorrectly prescribe themselves supplements or really take a wrong direction. So I think the interpretation is critical. It's really, it can vary so much, and you hear different things from different practitioners, and it really takes a bit of work to sort of go over the different tests available, understand what the different labs are offering, and then go for what you believe is the gold standard, and then make sure you interpret it correctly. And again, critical to do it alongside good case taking, isn't it? Really, that's always the most important thing. You can never just rely on one thing, especially just relying on pathology results. You've got to take you've got to have the good quality case taking alongside it. So, all right. Well, Shannon, do you have any tips for viewers out there, for any of them going to see a naturopath or a nutritionist or a specialist at all? Do you have any tips in regards to what people could do to perhaps help the case-taking process speed along sometimes, because we like to, we run out of time quite often? Or any tips that, any advice you give people going to go and see a practitioner in the immediate future?
Yeah, I guess giving that data and information in organized parts. So for example, a timeline is really helpful. So it started at this time, and then I had this operation at this time, and you can see, boom, straight away. All right, that saves a lot of questions. And you may even work out yourself as you're doing that. Whoa, as I mentioned earlier, ever since I've lived in this house, I've been sick. Maybe I'm living in a toxic house, or maybe there's mold issues, or maybe, oh, that's the air conditioner, and I always thought that was a problem. And other things like diet diaries, and definitely bring your bag of supplements.
Yes. Yep.
So I'm taking a vitamin D, or I'm taking a vitamin C. What brand is it? What's the dosage? All of that. So if you've got your bag, we can just look at it and say, yep, it's a good one, or no, throw it in the bin.
Yep. It's come from iHerb. And do we have to question the quality of the American supplements? Yeah, that's an excellent tip. Well, they're all great tips, Shannon, and I certainly second that. Those 3 tips, if people can maybe consider a diet diary, or monitoring the diet for a few days before they come into the practitioner, and timeline of events, that's a really good way to keep focused within the consult, and helps the practitioner get through a lot of questioning. And it's very important that if you go and see a practitioner, that you let the practitioner go through a line of questioning, because there's a rhyme and a reason to the process going on there, and there's a lot for us practitioners to get through. So we need to have specific questions answered, and hopefully get as an objective answer as possible, which is not easy to do. Objectivity in the questioning process can be hard to achieve. But yeah, some great tips there, Shannon. So where can everyone find you, Shannon?
Oh, me, I'm over in Perth, curamedicine.com.au. in Claremont, and just jump on the webpage, CURA Medicine.
Excellent.
Yeah, thank you very much, Brad.
No, thank you again, Shannon. I look forward to these conversations and videos now, and hopefully we can get a lot more happening on our Planet Health Project YouTube channel, and wherever these videos land. I'm Brad Parkinson. You can find me at bradparkinson.com.au online, and thank you for joining us. We'll see you again next time.
Bye.
Bye for now.